So please meet the like the marketing from the agent, James. Yeah,
Hi.
and
Hi, James.
this is
Yeah.
our study head, like our head of our academic group, Shane.
Hi, James. Yeah, it's very nice to meet you.
Yeah, nice to meet you.
Thank you so much for taking the time to meet with us today. I'm James from Montgomery International Consultants. We'd love to chat with you about the aged care course at Clinton Institute, how the program runs, and what students experience during their studies and internships.
上澳洲老年护理 C3 课的学生一般是什么背景？
So the background of the students, we have obviously students from Asian regions. We also have local students. Their knowledge background, if you want to talk about that, is that some of them come with a small amount of experience, but most of them come with no experience. And that's why we designed the course as we have, to give them the most knowledge before they get out into the workplace.
上老年护理 C3 课程，学生的英语水平如何？
Again, it's varying degrees of English levels, but on the whole, the English levels have been quite good. Above 3, they've been quite good. We also have a full week placement for students who might be struggling with their English, and it's not so much struggling with the English, but perhaps struggling with the concept or the idea of what we talk about in class.
Yeah.
All those strange words that they've probably never heard from before. So we have a free 4-week placement program for them at our English college to help them as well.
Oh, that's good. So it's very good for the onshore students to take these courses.
Yeah, absolutely. Yeah.
老年护理课程的学生能顺利毕业吗？对没护理背景的学生，课程难度大吗？
Every student who comes in has 3 chances to pass their subjects. But I generally find that most students pass on the first time, because it's not so much you need to know everything and here is the assessment and you must pass. It's a learning process. So
Yes.
every subject will overlay the other. So, and especially when you go into the workplace, most of the assessments, a large part of all the assessments for all of the subjects, are not concluded until you're in the work placement, because that's part of how the course is designed, to get into the workplace, get an understanding of what's happening and what you're supposed to be doing to have your assessment. So it's not really a pass or fail. And if anybody doesn't pass it, it really is only that they haven't applied themselves, or the timing maybe is not long enough for them. But otherwise, we haven't had any fails really. But the process is there to give them enough information. Like I said, they have those 3 chances at assessment. So, but on the whole, yeah, we don't have many failure rates because of that structure that we have. We don't just push them out and say, here, off you go. We really do give them that knowledge and learning.
澳洲留学生背景和境外直接来读老年护理课程有什么区别？
So if I'm understanding correctly, international students and our domestic students actually match very well together. So I don't want anybody to feel as though one group of students has a better understanding than the other, because everybody comes in fresh, and it's my philosophy that we give them the information. And like I said before, a majority of our students come with a knowledge of aged care, but that's about it. So there are opportunities for all students to advance their knowledge, and that's generally through the use of apps, and everybody's on an app these days. While we don't want everybody to learn from an app, that's why we have trainers. The apps are there, translation apps are there, to help students who may feel like they might be struggling a little bit or don't understand.
请说一下老年护理课程的实习安排。
Okay, so because one course is shorter than the other, so the 3-month course, things happen at a faster rate. than the 6 month, obviously, but they are both designed the same way. So students come in and do the prerequisite knowledge, which is the first aid, and then the food hygiene course. And our course, we included food hygiene, which is not necessarily in a lot of other aged care courses. And the reason we've done that is it gives our students a broader field for them to get into the workplace. So it's not just about personal care assistants in aged care. They could also work as kitchen assistants because they have the food safety knowledge that they're supposed to have to work in a kitchen. And then, they can also branch out into the NDIS components as well, because we give them a lot of NDIS webinars and workbooks and upskill them in the NDIS, which is quite helpful for our students as well, so that they can branch out not just in aged care, but in different areas of aged care. So what happens is that obviously, like I said before, most of the assessments for most of the subjects don't happen until the end when they're in the work placement. So for the 3 month people, we get them in and to do the work placement. And within about the 3rd week, we like to have their work placement already organised. So within the first 2 weeks, it's first aid, it's food safety, and joining the NDIS and updating their skills with all those courses and making sure they have all of the requirements, their driver's license, working with children's check, all of those organised. And they usually can take about 2 weeks. So that the 3rd week, we then are looking where to place them. And we give the students a range of places because, people are working in the living in the far out areas as well as close to the city. So and luckily now, because of our students, we're finding that aged care providers are approaching us. We started out with only one, we now have many more, so that's really good for us. And we give the students, depending on the area, we say, look, here are the aged care providers there. Which one would you like? And usually students pick 1 or 2. And then we go about setting them up with interviews, because the aged care providers like to meet the students, not just have the students, attend on the first day and not know anything. We also have uniforms for some of our aged care providers. They prefer our students to wear uniforms, so our students get uniforms to wear the whole time that they're at that particular aged care provider. And so we match the student with the aged care provider, and our trainers have to go out and assess our students a minimum of 2 times while they're in the work placement period, or what you're saying is the internship. Yeah. So it's work placement is the word we use. So our trainers get out there and, our trainers go out and see the students, go out and see the aged care provider, if there are any small issues or whatever, to talk about them, get them solved, and complete assessments. So in the bigger picture, that's how it works.
老年护理课程中的实习表现会影响毕业或者找工作吗？
Oh, we've had great success with our students at present in the workplace. We give the students a lot of support. One thing that I actually do for the students is I actually update their resumes and have their resumes included and do cover letters for the students. And we have a class and we talk about why we have a cover letter, what's in it, and I refresh their resumes and make sure that they're great resumes. We have a lot of other support with our trainers, because our trainers are still working in the industry, so they can also, when they're out in the workplace, because every workplace is a little bit different. So our trainers can also upskill them at that particular time by saying, look, they do it this way. I know I taught you this way, but here they do it this way, and this is the reason they may do it differently here. So there's a lot of support still for our students, and it's working really well because we've got a lot of students in the workplace. So yeah, the support is definitely there for them.
在老年护理课程的实习过程中，学生最常遇到的困难有哪些？
Well, I think some of the challenges have just been getting used to working in aged care. I think the way that we do it here in Australia might be a bit different to what is normally seen from where they come from. And I know a lot of Asia is interested in looking after their elderly, and a lot of their elderly grandparents and stuff live with them.
Yeah.
That doesn't sort of happen here. So I think there's a bit of a gap there. I think the students are very accommodating with the older people here in Australia, and I think some of the language, because having older Australians speaking not a different dialect, but words and phrases from old time
Yeah.
can confuse some students, and so they're going, "Oh,
Yeah.
what's they
What's that
asking?"
mean?
And that's where,
Yeah.
yeah, and that's where the trainers come in handy, and the students, what are they talking about? What does this mean? But also, it's not just the trainers. We also link the student up with the supervisors in the workplace, and that's also very important, because if the trainer's not there, then the student can't say, "Oh, what's this mean?" So the supervisor at the workplace is very important for us to match up with. So
Yeah.
the student can go to them and say, "Oh, I'm not really comfortable here. What's going on?" So that's also another very important. I think a little bit. A lot of the language is the basic
Language is
challenge.
the best. Yeah.
Doing the work actually is not a challenge, because, like I said, we have the lifters here, so they practice on the lifters here. They practice on the walkers here. They have practice on bed washing and everything on the dummies here. So they're fully prepared when they go out. So I think it's just a normal workplace working atmosphere that students may struggle with at times. That things might need to be done a certain way, and it's sort of somebody has to sort of go, oh, why? And I think that's a little bit of confusion. But
Yes.
yeah, ultimately I think everything's fine.
老年护理学生完成实习后，养老机构通常会如何对他们的表现进行评价或反馈？
Okay, so most of the feedback has been positive, as I've already told you. We've got quite a few students in work placement. Feedback ranges from, we would like to take this student on, and we would like to progress their career, maybe even give them an opportunity to go into nursing. Other feedback on the other end is that the student may need to feel more comfortable in themselves and become a little bit more outgoing, and don't be so shy when they're face to face with people
Yeah.
they've never met before. But these people are there, and they're dependent on their students. So students should feel very comfortable. They can go up to a resident and have a chat with them, because, to be honest, a lot of the residents are quite lonely and would love that chat from a student. Say, how are you going?
Yeah.
And this is where I come from, and how are you going today? Yeah, so that's the two ends of the communication spectrum. Yeah.
毕业后，你们的老年护理学生一般会去哪类机构工作？通常从事哪些岗位？
Okay. So most of the students, if they don't end up working at the work placement where they've been doing the work placement, they find other aged care providers. A lot of our aged care providers don't have one, obviously, aged care centre. They have many. So some of our students have been referred to other areas of the empire of aged care, if you like, because a lot of our aged care in Australia companies have more than one facility. Yeah, so they may go to one facility and then, oh look, you'd be really good. There's a position out X over there somewhere. Why don't you go over there and have an interview? Now, the different types of jobs, as I said before, it's not just about a personal care assistant. They work in kitchens as well. They do activities, because all of the aged care providers and facilities offer happy hours and lots of activities for the residents to fill in their day. So activities coordinator, we've got a couple of activities coordinators as well. But mainly it's the PCAs, kitchen assistants, activities coordinators. They then also, we've got one student going fully into the NDIS, into disability support. And they seem to be quite happy with that one, because disability support is also another big thing that we do. And we're on the verge of sort of doing more of. So there are different areas that they can go into. I always say is, when a student goes in after having learning, they may think, oh, I wanted to go and be a PCA. But, I'm here. I love the facility. I love what it stands for. I love everything about it. But I want to be a gardener, at this facility. So it's really, while we say, look, you're going out to be a PCA, we always want the student to explore what they feel comfortable doing and what they can see themselves doing. And if it's not being a personal care assistant and they'd rather work in the kitchen, or they'd rather do activities, then that's what they should do, because they'll be more happy and they'll make the residents much more happy doing something that they love.
老年护理专业的学生在学习期间有机会找到养老护理相关的兼职工作吗？
Is that easy?
Yeah, a lot.
Yeah,
absolutely. A lot of our students are placed in work placement, and then find that they're doing a part-time job. So they're earning money while they're actually at the work placement. Others are doing work placement but have a part-time job on the weekend in an aged care centre, maybe a different one, earning money. Again, aged care workers are highly sought after, and there are opportunities there if the student applies themselves.
Good. So I'm curious about what's the rate. Can you maybe tell us something approximate rate they can earn? They want to.
Look, we'll say per hour, anywhere from
per hour.
And of course, the range I'm giving you depends on the job they're doing, but anywhere from $35 per hour to $60 per hour. So that's
60.
a lot of money.
That's a lot.
Yeah, that's a lot of money.
Yeah, good.
Some people only work 3 or 4 days.
学校是否会为老年护理学生提供职业指导或求职方面的支持？
Yeah, I think I've already sort of touched on that. Yes, we do have a resume class, which is what I help them with. Their resumes, their covering letters, how to talk, how they can answer questions they're not sure about answering. Obviously, all the other trainers as well, who are still working in the industry, are out there also, and they may hear, oh, there's a job going here, and they'll maybe match that job with the student in their class. It's not showing favoritism, but often, the trainers will hear of a job that's there and think, oh, Tom would be very good for that, or Alicia would be very good for that. So there's a lot of that support with the workplace coordinators, and in-house as well. Also, like I said, doing all of the practicals here in our setup room, which gives the students extra confidence so that they actually go out and know what they're supposed to be doing and how, or what it feels like, or what it looks like, rather than just say, here, go and do this. So there we do provide as much support as we can. And that's a one-on-one, face-to-face classroom. We also have a lot of videos as well that we can show students as well as part of the course. We do have a lot of support for the students. We want them to do well.
老年护理毕业生找工作难吗？有雇主愿意帮忙办工作签证吗？
Yeah, so they can. Absolutely. It's more in outer regions like regional, where they really don't have the workers out there. And so to attract workers from Melbourne, the city, out into, like past Ballarat or Shepparton or Warrnambool, is that they do offer, or can offer to the right person, sponsorships. to be able to work and obviously stay longer in Australia. Yeah. They are there. It's yeah.
So they still have chance. Yeah.
Look, we need childcare workers. Absolutely, they have a chance if they apply themselves. And do the learning. Yeah, absolutely. There is a chance there for those stars. Yeah, absolutely. They shine very brightly.
老年护理职位的平均工资是多少？职业发展前景好吗？
Again, depending on what the student is doing, like if you're working in a kitchen or if you're doing the activities or if you're doing a PCA, and again it will depend on those penalty rates. If you're doing night work, weekend work, early morning work, it's all really a mixed bag. The opportunity to earn more money obviously comes with if you're doing a night shift or a weekend shift or a very early morning shift, and those rates can be up above. I'll just say a minimum of 50,
Yeah.
but certainly up above, way well up above and into the higher ends, but definitely starting at 50 and up to 65 and beyond. But again, depending on what you're doing and the dates and the times, the hours that you're working. Yeah. Plus, there's also lots of overtime available as well. And of course, overtime, then your rates go from 60 an hour up to almost $100 an hour or more. And it's, wow, you only need a few hours of overtime rates, and that's a Christmas present then, isn't it?
您对那些想毕业后留在澳洲工作的老年护理学生有什么建议吗？
All I would ask them to do is to come, to apply themselves, ask as many questions as they possibly can, and make sure that they do understand the answers. Our trainers are here, especially here, that if a trainer answers your question and the student really didn't, what's going on? Ask again, please ask again, because the more knowledge you have, the more understanding you have, places you in a far better position out there in the real world than somebody who's just read a book and go, oh yeah, I know what I'm doing, and they end up not really knowing what they're doing. So the more questions a student asks and the extra reading or the extra knowledge gathering that they can do outside of class is always a benefit to them. But just apply themselves. Yeah, it's not about having a holiday. It's about having a career for yourself and making somebody's life happy.